What is the Halachic debate around brain death and organ donation? Imagine a world where saving a life is considered a sacred commandment, but deciding when someone is truly dead is not so simple. That's what the Halachic debate around brain death and organ donation is all about. It's a question that touches on how Jewish law understands life and death. Medically, brain death means all brain activity has stopped permanently, including the brain stem, which controls breathing. A person declared brain dead may still have a beating heart because of machines supporting them. But Halacha, Jewish law, traditionally sees death as the end of spontaneous breathing and heart function. So the big question is, does brain death count as Halachic death? Some rabbinic authorities say yes. They argue that when the brain stem stops working, the person cannot breathe on their own, and all brain functions have ceased. Since breathing and heartbeat are signs of life in Halacha, they say brain death is enough to declare someone dead. This view allows organ donation at this point, which helps save many lives, especially vital organs like the heart and lungs. Others disagree. They believe that as long as the heart is still beating, the person is alive according to Halacha. They hold that brain death alone does not fulfill the Halachic criteria for death. To them, removing organs from someone with a beating heart would be considered murder because the person is still alive in Halachic terms. There are also more cautious approaches. Some rabbis say organ donation is only permitted if the heart has stopped beating naturally, not just because of brain death. They requiring strict confirmation from medical experts and rabbinic authorities that the person is truly dead. This limits organ donation to cases of cardiac death, where the heart stops on its own, which makes organ preservation easier and more reliable. Practically, this debate influences how Jewish communities approach organ donation. Many see it as a mitzvah, a commandment to save lives, which overrides other prohibitions. Some people carry donor cards, indicating whether they agree to donate at brain death or only after the heart stops. The timing matters because organs deteriorate quickly once the heart stops, making donation after brain death more effective for saving lives. In summary, the Halachic debate centers on how to define death, whether it is brain death or cardiac death, and this affects whether organ donation is permitted. Many authorities accept brain death as Halachic death, enabling organ transplants that save many lives. Others requiring the heart to stop first, which influences how and when organ donation can happen within Jewish law.